welcome to Ask Julie Anything. Tonight we've got Equine Nutrition Therapy, and Sarah Griffiths is joining us. If you don't know Sarah, she hangs out on our Facebook group all the time. She's also quite a few of our community members, homeopath and nutritionist. Welcome, Sarah. Thanks for joining us.
Hey guys.
And my best friend, one of my best friends, and one of my proteges, and a little bit protege. Sarah started with me like when she was like a baby.
21 years ago. I was figuring it out yesterday, actually.
Wow.
Wow.
So you've known each other for a long time.
I really want to learn all this, and I do nutrition with big cats, and I do this and I do that, and I'm like, okay, got a job.
Yeah. And now we're here.
Awesome. Very excited. Thanks for joining us. So if everyone has questions, we'll do Q&A at the end. If you could submit your questions. Sarah's brought a presentation that she worked super duper hard on. And I'm really excited to listen to her and learn something new. If you can, put your Q&A in the Q&A area. We'll reserve the chat for chat. And if you'd like, we can do Q&A on the mic at the end of the presentation. What do you say?
That's always fun, eh? I think that's
for sure.
Yeah, I really like it. All right, without further ado, Sarah, we are super excited to have you on tonight. Let's do it.
I'm not in Russia. If anybody it's under construction and I'm freezing. So
awesome. That's okay. You're allowed. I'm the same. I'm always freezing. So
well, the dogs love it. The first time in like a year without panting.
Yeah, for sure. Okay, so I'm going to share my screen with you guys, and then if you have any questions, I'm going to try and blast through these slides fairly quickly. I do have a PDF version of it, so if anyone wants the slides, I can send them because there's a bunch of information on them. I'm going to try not to spend too long doing the presentation so you guys have more time to ask questions. And then if you want to email Steph, I can forward her the PDF version and you can have access to all the slides. So how do I share my screen with you? How come I can't see it?
At the bottom, it's
there
a green thing.
There we go. All right, so here we go. There we go. All right. Sorry, guys. I'm a little technically challenged. Give me a second.
Great. It looks awesome.
There we go. Slideshow. All right. All right. So thank you so much for having me, you guys. I love coming on here. It's so much fun. And I did this on the fly a couple days ago. I dislocated my ribs. And I was really bored and I was thinking about what I was going to say. And I was like, oh, I'll just make this PowerPoint presentation. And I sat there kind of disabled making this talk for you. So a little bit about me. I've known Julie for a really long time. I worked at the Adored Beast Veterinary Clinic in BC for, I think gotta be about 5 years. And I met Julie when I was 17 years old. So I've had a lot of really amazing learning from her. She's been my mentor for 21 years now.
So you worked for us for 5, then you went away and did all your like big wildlife stuff and worked with zoo stuff and wolves and large cats and all that. And then you came back. Remember when I opened the clinic in North Van?
Yes. Yeah. So
and they're been around with me for a long time.
Yeah. And then now we're kind of working together again, which is really cool. So So yeah, I have a background in wildlife management. I have a diploma in exotic cat management. I have been an equestrian since I was 7, but then more professionally in the last 5 years or so. And I really wanted to learn more. I work on a species appropriate, species origin kind of philosophy, where if I'm looking at an animal, even if it's a domestic animal, I really strongly feel that they are still genetically linked to their ancestry. So when you're looking at species appropriate diets, which I'm really into for dogs and cats, I wanted to apply that knowledge to horses as well. And it does make it a little bit challenging with horses, because there's not very much research on horses in horse nutrition. It's a lot of the research that's been done so far has been on very synthetic supplementation and feeds and things like that. So the whole food realm of equine nutrition is almost non-existent. There's not a lot of research, so it's kind of trying to find the missing, like the puzzle pieces that can give you a little bit of an insight as to what the heck are we supposed to feed them. And especially since we have so many people who have performance horses who are doing a sport, what do those horses need? Because that's a whole other topic than just a horse living in a field. So so this is, to the best of my knowledge so far, from what I have been able to discover clinically and through all the research that's available through the university so far, this is some of it is going to be theory, because we don't actually have a lot of information. So
Hold on, before you start, I have to say something.
Yeah.
So for people that are watching, when Sarah's being like super duper non-ego, of all the nutritionists that I've met in 26 years and in this my career, when it comes to dog and cat nutrition, I don't think there's anyone that can hold, I shouldn't say can hold a candle, because I don't mean it that way, but Sarah, to me, has the most intuitive and intuitive wisdom and knowledge about canine and feline nutrition. She does all my own personal animals. When it comes to their nutrition, that's who I go to. That's my go-to person. And when she says that she learns or she researches, she's so much like me. We're talking research like going to bed and falling asleep with your computer on your chest. Really very bad for you. But to really get down and not just look at research, but then take that research and even dig deeper and even dig deeper. And she has an incredible way of looking at nutrition from a really high level, not just as nutrition. So when she says this is what she knows, I don't know a lot of nutritionists, equine, feline, or canine, that will be able to give you as much knowledge as she does. And the way she learns, in my opinion, is it just encompasses the entire animal. So when she's well, it's true. You know what she did with it, I'm just going to say quickly, when she first started working with me, I had one of the most amazing vets that worked with us, Dr. Dave Roosh, and he worked with us for almost 20 years. And he said to her, and I said to her, okay, great, go write a book, right? And what year was that when you guys finished that book, you and Dave? It's Oh my gosh, it must have been like 2006. No.
Oh, it was longer ago than that. It was like
Yeah,
2002 or something like that.
you know what? That information, there's still not that the information that's in that book. There still isn't that information out there. So Sarah writes a lot of blogs for me because from a nutritional point of view, like on pancreatitis, dog pancreatitis and stuff, because of the way she looks at it, I think is really unique. So I just had to sort of jump in and say that because what you're about, I haven't even seen this yet. I know she sent it to me. I haven't even looked at it because I don't even have to worry about this stuff because she's like I said, she's my horse's nutritionist and my dogs and my cats. So you're in for a treat. And I just didn't want her, what you guys beginning this and thinking that she's just learning or something like that because she's not
Thank you.
ahead of her time. Okay, bye.
Sarah, someone's asking if what the book is, if we can get our hands on it.
Oh, well, it's not a book really. It's a very old, I guess it would be like an ebook. I guess it would be an ebook now, like a PDF. It's really old. I would say your best bet is actually to read the blogs on the Adored Beast website because they're more complete because those were written very long time ago, and I learned a lot more since then. So I might read that and go, oh my God, what was I thinking?
No, but we used that book in our clinic for 7 years because it was so far. Yeah, you read it and there's still I get what you're saying. I just still think that, and you've evolved immensely. I'm not saying that, I'm just saying that there's still stuff that I read in that book that I haven't heard from anybody else. There's stuff that's
I do have it somewhere. If you really want it, email Steph and I'll send it to you.
we should put a new one together. That's what we should do. All right. Sure. All right. Okay, I'm going to shut up now.
That's okay. Thank you, Julie. So these are basically my top 6 nutritional deficiencies that I feel are kind of an epidemic at this point. And I think that it's fair to say that there are a lot of diseases that horses are getting in modern equine management that are dietary. They're actually nutritional deficiencies and not as much the disease that's presenting. So basically the disease that's presenting is the aftermath of possibly something very chronic that's been going on for a very long time. So so these are the top 6 things that can go massively wrong that there is some concrete data on, and there are some ways that you can really address this with food. And we're going to talk about food that contains these things, and then also how you would supplement for these deficiencies as well. So it kind of all ties together in the end. So the top 6 nutritional deficiencies that I see on a pretty regular basis, and you can usually see this through blood work with a lot of these. So calcium, selenium you can't, magnesium, B12 you can, vitamin E you can, and omega-3s, mostly omega-3s and selenium you would see clinically, you would see symptoms that would say, oh, I think this horse needs these nutrients. And a lot of horses are living on diets that are fairly deficient in the first place. And I believe that horses that are, especially performance horses and horses that are dealing with maybe a little bit more stress than your average horse that's just living in a field or has retirement or whatever, they are dealing with a different level of stress. And that also makes them more susceptible to disease in a whole bunch of different ways. So calcium is a huge one. There are so many horses that are calcium deficient, and it's really not that hard to balance the calcium phosphorus ratio, but a lot of people are feeding forage and they don't know what is in their forage. So I really encourage people to get an analysis of your hay, because they will give you a calcium phosphorus breakdown. And if that's mostly what your horse is eating and that calcium phosphorus ratio is wrong, it can be devastating. So the biggest thing that you see with calcium deficiency is musculoskeletal issues and neurological issues. And that's because calcium is in your body, in your horse's body, calcium exists in the most, it's the most prevalent mineral in your body, and it makes up a huge part of our bones, and it really makes a big difference for neurological function. So it has a huge part to play in how your neurological system is functioning. So sports injuries, arthritis, bone spurs, string halt, any kind of neurological issue, even if it's degenerative, there's usually something going on with the calcium phosphorus ratio in their diet. And sometimes you have to analyze pretty closely, what is it that you're giving your horses on a daily basis. Excess starch and excess protein can also have a factor in creating an imbalance in the calcium phosphorus ratio. Confinement and also some drugs will affect how much calcium is being leached out of the bones, and also how much calcium they're able to absorb from their actual food. So there's certain medications, primarily steroids are a big issue with even performance horses that are getting older. A lot of people just do steroids to maintain their horses, which can have some pretty devastating side effects and cause calcium deficiency. Next, whoa, there we go. So with all of these deficiencies, I'm going to talk about food and I'm going to talk about supplementation. So food is always my primary way to give these, to like balance the diet through food and not with supplementation. But sometimes these animals are so deficient in something that in the beginning, they're going to need, while you're balancing the diet and getting them back on track, they may actually need a supplement. So beet pulp is a great one. It's quite high in calcium. If you're going to feed beet pulp, you have to make sure that it's non-GMO. A lot of people are feeding beet pulp, but they're feeding they're not feeding non-GMO, and the amount of chemicals that you're feeding your horse, if you're not feeding non-GMO, is really disturbing and has a whole different level of toxicity and endocrine dysfunction and gut dysfunction attached to that, which can just wreak havoc on your horse. Same with alfalfa. A lot of alfalfa is heavily sprayed. So if you're going to use it as a calcium source, you have to use organic or non-sprayed. You have to make sure you talk to your hay people and find out what they're doing with their hay and what they're doing with their alfalfa, because otherwise you could be causing a bigger issue. Chia seeds are actually great, and for a bunch of other reasons as well, which we'll talk about in a bit. And then leafy green vegetables, which some horses are into and some are not. So you can, sometimes your horse will actually tell you which veggies they like and which ones they need. Others are not quite that intuitive, but dandelion is a big one. You'll see them eating that like crazy in the springtime, and that's quite high in calcium as well. So for adult horse, a 1-to-1 ratio is perfectly acceptable for horses for calcium phosphorus. And unfortunately it's not that hard to reach, but unfortunately a lot of horses aren't actually getting that. So very important to get your hay analyzed. I also have a blog on the Adored Beast blog about how to analyze your hay and what you need to do if if it doesn't look right. And for supplementation, calcium citrate is one of my favorites because it's buffered, which means that it doesn't have a really acidic effect on the gut. And a lot of horses are dealing with issues, gut issues in the first place, and we don't really want to be starting to put more stuff in there that's going to irritate the gut. So the calcium citrate is a great way to do that without upsetting the stomach. So 2,000 milligrams a day for 4 weeks, and then you can go down to twice weekly after that. But I do recommend that people also be tuning into what they can do on a whole food level while they're doing the supplementation. So switching their diet over the course of that 4 weeks, so that when you go down to your maintenance dose, that you've dealt with the diet on a whole food level, and they're not just, the diet isn't just staying deficient and you're just supplementing. So that's not really the goal, because we'll talk a little bit later about why that's so important. So number 2 is selenium. This is also really, for everyone, it's really hard for any animal, human, horse, to get enough selenium in their diet. And the reason for that mainly is that there's not a lot left in the soil anywhere. So we have to sometimes supplement with selenium, unless you have a really high selenium source like Brazil nuts, but Brazil nuts aren't really a species appropriate thing for horses. So, so the selenium is really heavily involved in thyroid function, sugar metabolism, musculoskeletal function, immune system function, gut health, liver health. It's just so important to have enough selenium in the diet, and a lot of horses are, almost every horse I think is deficient in selenium. So it doesn't hurt to supplement them with a safe level of selenium on a daily basis. A lot of conditions like tying up, which can be kind of painful, skin and hoof disease, especially if you're seeing problems in their hooves, hypothyroidism, any kind of insulin resistance, fatigue, liver, and metal toxicity. Heavy metal toxicity is really hard for horses to handle if they're already selenium deficient. So if you're seeing on a blood test or hair analysis that they have heavy metal toxicity, start using selenium. Some of the signs are dull coat, skin disease, sweet itch, really chronic sweet itch that just won't go away, immune system dysfunction, hypothyroidism, equine metabolic syndrome. Every horse that has EMS should be on selenium, and any horse is having hoof growth issues. So a lot of times you'll see cracks in the hooves. That's one of the kind of the signature signs that a horse is deficient. And a lot of times just from that alone, just changing the amount of selenium in their diet, you can make a huge difference in how their hooves are growing, and the farrier will be a lot happier with you once you have your horse on selenium. So the reasons for selenium deficiency are deficient diet. There are a lot of drugs that will stop the uptake of selenium, so they actually need more. Excess dietary starch, again, can really wreak havoc in that area. And if your horse has been exposed to some kind of heavy metal toxicity, they're going to be deficient, and they're going to need more to get their liver working again properly. So foods, in an ideal world, grass and hay is wonderful, but unfortunately a lot of it is deficient. So, and whole oats are another way that you can add some in, but whole oats don't work for every horse. So it may be hard to get enough selenium into them, especially if you have a horse that's having some kind of sugar dysregulation. I actually recommend using the supplement, and this, if you're using organic selenium, you're okay. So then you can add that into any diet. So it's called selenium methionine, and that is the organic version of selenium. If you see anything other than that, don't use it. It can actually become a source of toxicity for your horse if it's not organic. So really important to make sure 1,000 to 2,000 micrograms daily. And you can go on the high end if you're having any of the aforementioned issues going on. You can go on the high end of that for a while and then drop down to 1,000 after 4 weeks. Magnesium, another one that is a common issue and also very tied into insulin resistance and endocrine function, and immune function as well. So if you have a horse that's super high anxiety, super nervous, spooking, muscle spasms after training, colic with spasms in the gut, hard keepers that are really hard to keep weight on. Those are kind of the things that you would be looking for in a magnesium deficient horse. So these horses are generally, they will actually, their behavior will massively change when they're getting enough selenium. So that's a big sign that if you start using magnesium and their behavior really changes and they become a lot calmer, it's probably likely that they were deficient in magnesium. Again, it's usually the diet that's the main culprit there. And the other one is gut damage. So we're going to talk a little bit more about this in a bit. Gut damage is another one reason, and a lot of horses have gut damage. So excess dietary starch, again, stress and overtraining is that they actually need more when they're training more. So even if they're getting some in the diet, they can still benefit from having a supplement. And then some drugs, again, medications can make a difference there. Grass and hay, ideally, again, it's in the ideal world, that's where they would get it from. And green leafy veg and seeds are my #1 favorite thing to feed to horses to get them to get daily requirements for that. But in the beginning, if you got a horse with this kind of scenario going on, magnesium citrate, 1,500 milligrams every day for at least 4 weeks, and make sure you start incorporating the seeds into the diet. My favorite is soaked chia seeds, and the reason for that is also because of the gut healing factor of soaked chia, which we'll talk about in a bit as well. And then if you're dealing with acute colic and your horse is having really serious gut spasms, you can actually use magnesium in a higher dose to help relieve those spasms. So 2,000 to 3,000 milligrams at the time that you're seeing that happening. That can make a big difference in whether or not you have to throw your horse on the trailer and run to the vet. So that's it's really important to have in your first aid kit. Vitamin B12. So B vitamins in general, a lot of horses have issues with. This is the one that we can test for in their blood work. So this is the one that if you get your vet to test for it and they're deficient in this, the #1 reason they're deficient in B12 is their gut is not working properly and they have a microbiome imbalance. So the microbiome actually makes a large portion of the B vitamins for our bodies and also for our horses' bodies. So if you're seeing that, it's time to repair your horse's gut. It's so important. So we're going to talk about that more in a little bit. But if you're seeing if you have a horse that's, again, anxious, nervous, colicking, recurrent colic, horses that can't deal with stress very easily, those are really common signs that your horse is dealing with a B12 deficiency, or more than just B12, like all the Bs. So Anemia is another one that's really common with horses with B12 because it helps them to create their red blood cells. So if they're not getting enough, you're going to see that they're not having enough red blood cells on their blood panel. Nervous system disorders, fatigue, horses that are like in training and they just cannot get any stamina. If you're seeing that, that's a very, very big sign that they're deficient. Weakness in seniors, you start to see them kind of having problems getting up off the ground after they lie down. Really tired, just not able to really get going. That's another really big sign. Insulin resistance again, and liver toxicity. If the liver is bogged down, then all the Bs are not happy, so you have to supplement. Reasons, again, gut damage, ulcers, huge reason. If you have a horse with B12 deficiency, they probably have ulcers. Stress, so making sure that you're assessing your horse's lifestyle, their stress level, how they process stress, because some horses process stress very stoically and others will be really outwardly dramatic about it, but it doesn't mean just because your horse isn't spooking and exploding, that doesn't mean that they don't have stress. So that's a really important factor. You have to assess from their point of view what their stress level is. Low stomach acid, which can happen with certain drugs and also with just having a lot of stress, and microbiome imbalance. So probably the number one reason is microbiome imbalance. So foods, grass and hay, they do get some. Spirulina and seaweed are a great option, though I don't like to use those on a continuous basis. So I like to put them on it and then I like to take them off of it and kind of rotate them in and out, just so you're not giving them excess in other things. So I also love to use, this is my new exciting favorite thing that I just started learning about, that mushrooms are amazing, amazing, amazing for gut health for horses and stress reduction in horses, and also all the B vitamins, which is really cool. So the other way that you can do it is adding a supplement. So methylcobalamin is the most natural supplement version you can give. It's the most bioavailable. So you can give that on a daily basis. If you're in a pinch, you get your blood work and it says it's really low. You can get this going while you start to add those other food factors in there. So 6,000 to 12,000 micrograms a day. And this is a water soluble vitamin, so you can't overdose on it. So the horse will use what it needs and then it'll just pee the rest out. So it's a pretty safe one to use. Vitamin E is also another one. This is a really tricky one because I think all horses can benefit from vitamin E. And vitamin E is an amazing antioxidant. So it deals with free radicals and inflammatory disease in any body system. So it's just one of those things. It's usually if your horse is getting out on well-managed pasture for the majority of the year, they're probably getting enough from the grass that they're eating. But again, like, how do we actually know that that's happening? And all the lifestyle factors enter into that. So if you have a horse in full-time some kind of sport and they're training, they're going to be dealing with more inflammatory stress. And a lot of people use things like ice boots and a lot of external measures to try and reduce the amount of inflammatory stuff that's going on in their joints and in the rest of their body. And I like to deal with it from an internal perspective rather than just putting things on the outside of them, though ice boots have definitely been shown to reduce inflammation. I think they're useful, but I don't think that alone they are going to do the job if you're wanting to keep your horse sound and inflammatory free into their later years of their training. So I think it can help, vitamin E can help preserve everything and help your horse actually live longer and be more comfortable for longer. So I'm a big fan of actually rotating through vitamin E rich foods and also adding a supplement in the winter, as long as it's a natural supplement. So I'll talk about that in a sec. So things that you might see if you have a horse that's deficient in vitamin E is cataracts is a huge one. Arthritis, kidney disease, liver disease, and pretty much every senior horse can have vitamin E and do really well on it. So if you have an aging horse, a horse, especially if it seems like it's aging really quickly, really fast, and you don't really know why, this is a good nutrient for that. Deficient diet, again, is the most common because most horses are just not getting out and eating and grazing out in the pasture as much as they should be. Liver and kidney toxicity is another huge reason. So they actually need more if they're having that problem. So foods that are high in vitamin E, black oil, sunflower seeds are a great option, though they're also really high in omega-6s. So you have to be a bit careful, making sure you're balancing your omega-3s, which is my next slide. Green leaf veg and grass. Pumpkin seeds are great, though they're also really high in omega-6. Dried cranberry can be a great one, and grapeseed oil, again, high in omega-6. So I like to rotate through these things while also giving them an omega-3 balance so that you're not creating inflammation in their body, because too much omega-6 and not enough omega-3 can also increase that inflammatory response in your horse. So supplement any kind of D-alpha tocopherol or anything that says D-alpha tocopherol. That is the natural version of vitamin E. Don't use anything else. You have to use a natural sourced one, and it has to be a liquid. So if you're feeding a powder, throw it away. It's not doing anything pretty much. Like they can't, it's not bioavailable for them. So you have to give it to them in a liquid format. In the States, there is a company called Kentucky Equine Research, and they do vitamin E liquid that is very well known. It's called Nano E, and that one I like to use in the winter because the horses just aren't getting out on the grass where we are, and my horse is in full-time training. So 1,000 to 2,000 IUs daily. And then you can actually use up to 5,000 IUs if they're going into competition or some kind of stressful event. Maybe the vet's coming out to do some procedure or something. You can give them more that day, or even for a few days after that, just to reduce the amount of stress and the amount of inflammation that's happening in their body. And then number 6 is the last one. So omega-3s. I think like every animal being on the planet is deficient in omega-3s. And I think that this is a relative one because I think that omega-3s are A, hard to come by in a really good quality form, and B, we are dealing with a lot more stress, a lot more stuff that's going to give us inflammation in our bodies. The same with our horses. So we need to actually give more omega-3s than probably what's recommended by the authorities in equine and canine and feline nutrition. So digestive system, highly needed in the digestive system. Urinary system, nervous system, immune system, almost every system. These are probably the top 4. So inflammatory diseases, any type of inflammatory disease, you can benefit from omega-3s. Ulcers and colic, they have to go on omega-3s. Joint related issues, or if you just want to preserve your horse's joints, make sure that you're getting enough omega-3s. Kidney disease, there's a lot of new research that's showing that even over vitamin E and vitamin C, omega-3s make the biggest difference for horses with kidney disease, and same with dogs and cats. It's more needed nutrient for them than some of these vitamins are in reducing that degenerative process that's going on, or just slowing it down at least. Skin disease, huge for skin disease. If you have a horse that has any kind of skin disease, get their omega-3s sorted out. And neurological diseases too. They can, even degenerative ones, it can actually be an omega-3 deficiency or a multi-nutrient deficiency. Signs, obviously, any inflammatory response in the body, anywhere in the body. Recurrent colic is another one. Recurrent joint and ligament issues, especially ligament related issues, they need to have more than your average horse. Dandruff and skin problems, and neurological issues. Reasons is usually deficient diet. Most horses are not getting enough because they're not eating fresh grass all the time, which is usually how they would be able to make enough for themselves. And liver and kidney toxicity, if they're really bogged down, they're going to have a lot of trouble if they're not getting enough omega-3s. Gut damage, they need so much more. And obviously, we already talked about inflammation. Foods that are species appropriate for horses that are omega-3 options. I actually like to just use whole foods when it comes to omega-3s. So a lot of the other stuff you can use supplements. But omega-3s, there's almost no way to give them omega-3s in a format that is going to be useful to them and not actually cause more harm than using food. So you have to use food to give them enough access. And don't use fish oil. Please don't use fish oil. Fish oil is completely not appropriate for horses. And it's not environmentally sustainable either. And a lot of it is just such poor quality. It's been sitting on the shelf too long, and it's going to actually cause more harm to your horse than it's going to do any good. So, and it's really expensive. So, so don't use that. I, again, really like soaked chia. You can use flax as well. I usually fresh bust it if you're going to use flax. The pre-ground flax meal that you buy is definitely not going to have the same amount of omega-3 bang for your buck as if you are willing to grind it yourself at home. Phytoplankton is another one, and also spirulina. They both have all the precursors for your horse to help them make enough omega-3 or DHA and EPA, which is hard to get in a horse diet. And then hemp seeds are also really great for increasing the omega-3s. And I like to rotate all of these together and not just give them one source all the time, because these foods also have different gut healing effects on the body. So if you're rotating through them, they're going to have access to so many different nutrients that they're not going to be really able to get just from eating forage and eating hay and things like that. So this is kind of like giving your horse like a super diet. So especially for horses that are in competition and dealing with more stress and more impact and more all of these things, they need more access to these foods. It's going to preserve your horse for so much longer. So soaked chia, I usually give about half a cup a day is usually plenty. That's for a normal sized horse, so about 1,000 pounds. Fresh ground flax, you can give up to a cup daily. Hemp oil, you can use as long as it's good source. I believe Adored Beast has one. You can use that one. I don't think I recommend any other one. So 3 to 5 tablespoons a day. You can always go with that in the beginning while you're loading, and then you can go down to 2 tablespoons a day would be plenty. And then phytoplankton, you can use up to a half teaspoon daily for horses. And that will give them a huge range of not just omega-3s, but tons of different phytonutrients and vitamins, minerals, etc. It will give your horse such an advantage. I can't even really emphasize that very much more. So I said there were 6, but there's actually one more. So this is the last one. People don't really think of probiotics as a supplement or a nutrient per se, but when your horse is eating and foraging and living in a field, they are eating probiotics all the time. They're eating microbes all the time. They're eating dirt all the time. So this is how they inoculate their gut in nature, and a lot of horses are not getting access to do this. So I believe that every horse should be on probiotics if they're not living out in a pasture. And even horses that are living out in a pasture, if they're only on one pasture, they may have a limited range of probiotics that they have access to in their area. So to give them access to other types of beneficial microbes is not going to hurt them. And a lot of times you do see a difference in their health just from adding different ones. So gut health over everything else, all of the things I just talked about, nothing is going to get absorbed properly. So you can give the best supplements, the best diet, the best of everything. And if your horse's gut is damaged, it doesn't matter. You can spend all the money you want on food and it's not going to matter. So this is the number one thing that you have to pay attention to. If you even suspect slightly that your horse is having a gut related issue, if they have diarrhea, intermittent diarrhea, colic, if they're girthy, if they're having hoof growth issues, all of these things are signs. If they can't keep weight on, those types of things, if they don't have enough stamina, all of that stuff is also gut related. So if their gut isn't healthy, they're not going to absorb any of these things. So probiotics are not just great because of the microbes themselves, but the microbes actually make these things called postbiotics, which are kind of a newer realm of study that is showing like the actual things that the chemicals, that the compounds that probiotics or microbes make inside our gut when they're living in a healthy gut. They are giving your horse nutrients that you can't supplement for. You can't give those to your horse. The microbes have to make those. So if your horse's gut is healthy, they're getting nutrition just from having a healthy gut. And then it makes it way easier for them to actually uptake any supplementation that you're giving them. So it's just so important to remember that every horse should probably have their gut health assessed, and you can even treat your horse as if it has a gut issue to see what happens, because it's not going to hurt your horse to put them onto a good probiotic. So now, big announcement. Oh yes, first. So probiotics and gut health are really well known for their benefits for the gut and for a number of other, even there's been some research on diabetes and how it helps with blood sugar management, Parkinson's disease, multiple sclerosis, neurological stuff. There's a gut-brain connection research going on. But a lot of people don't know that probiotics, this is also being researched now, on kidney health. So kidney health is is very determined on their gut health. So if their guts are not functioning properly, or if they have what we call leaky gut, they're actually absorbing so much toxic stuff through their gut that it can actually put a huge strain on their kidneys. And so this is a bit of a personal story. This is my horse, Kingsley, and he's 5 years old now. And I've had him since he was a baby, since he was born. And he had a whole bunch of really crazy health-related issues when he was younger. He had some growth issues. He had these recurrent colds. He was just having all these problems. And when he was 1.5 years, I gelded him, and he went on just a maintenance dose of bute for recovery, and he almost died. So he went down in his stall. He wouldn't eat. He was grunting. He was in extreme pain. And we did his blood work, and it showed that he was in like full-on kidney failure. And we were like, oh my God, like what the hell is happening? Unless somehow I had accidentally overdosed him on bute. We had no idea what was going on. So both of us came to the conclusion that we had to do an ultrasound. And sure enough, he only has 1 kidney. So he was born that way. He doesn't have full function because he only has 1. So he can't have drugs like bute or a lot of the sedatives like ACE or Dorm or things like that. And thank God he's such a wonderful horse, and he's got a great temperament, so he doesn't need to have that most of the time. But that was a big wake-up call for me, that I was going to have to find some other way, which it's so funny that he ended up being my horse, because that I always try to find those other ways. And so basically I had no choice. I can't do a lot of the stuff that normal people do with their horses. So for many years, my vet, who is an amazing, amazing vet, her name is Dr. Poirier, she's in BC here. And we did a number of, we did blood work on him every day for a month, and to see if his levels were going to go down. And then finally they did go down to kind of what you'll see, this top number here. And then we were like, well, this might just be his normal. So his SDMA and his creatinine are actually a little bit elevated. His BUN seems normal there, but it goes up and down as well. So because he only has 1 kidney, we thought, okay, maybe he's just, going to be on the high end, and that's just going to be his normal. And we're just going to have to be really careful that we don't cause any damage to this 1 kidney. Until I started him on the Adored Beast Gut Soothe, the dog one. And Julie helped me to figure out what dosage we should be using with him. And you'll see on the last set of bloods, which is the bottom one, that his SDMA, his creatinine, and his urea are all normal, which is the first time in his life that's ever happened. So that was a huge, huge wake-up call for me, that no matter how well you think you're doing or how normal you think something is, you can always fix things with probiotics. So that was a really cool finding, and there is a lot of research that's being done on kidney health and probiotics, and I just wanted to share that with you, because something that we don't really think of. But even if your horse doesn't have a kidney issue, you can definitely avoid having one with your horse if their gut is healthy. So that is that. And little announcement. Woo! Yay! So there is going to be some access to through the Adored Beast to do probiotics with your horses. And I believe strongly that this probiotic in itself is going to kind of blow all the other equine probiotics out of the water. There's really, I've had my horse on probiotics for the whole time I've had him. I've tried all the different brands. I've even done the ones that the vets have told me to do because they're the ones that seem to have the most research done on them, and they did nothing for his kidney levels. This is the only one that's ever done anything for it. So thank you so much, Julie. It's amazing. And then the other thing I just want to mention is I've partnered with a company that does hair testing. So if you suspect that your horse has a nutritional deficiency and you want to check, or if you want to see if they have heavy metal toxicity of any kind, you can use hair testing to do that. And hair testing is pretty it's more accurate than saliva testing for especially for this one test for intolerances as well. And hair testing can be a lot more useful sometimes than saliva testing. So this test does beddings, it does a bunch of other environmental allergies, foods, and vitamins, minerals, amino acids, omega-3s, and heavy metals. So it can give you a bit of an insight as to where you might need to start. And there's a lot of empirical clinical data showing that when these are applied, that the animal starts to get better and change. So I like to do it as a baseline. It's not always 100% the be all end all, because there's a lot of other factors besides just what the hair testing is saying. But I find it's a great tool to be able to have a place to start anyways, because sometimes it can be really overwhelming as to what you actually need to do with your horse. So thanks so much for listening. I want to leave some time for questions, so I'm going to stop talking. But you can reach me through my website or through Adored Beast. My new website is The Animal Synergist, and I also own a company called Equine Soap Co., which you can reach me through. And then obviously if you get a hold of Adored Beast, they can also direct you to me as well.
Absolutely. That was awesome, Sarah. I was taking notes.
Oh my gosh, it was long.
No, it was great. I was taking notes, and I put all the links to your blog, to your Equine Soap Co., to the Animal Synergist, to the liquid vitamin E in the chat for everyone if you want to copy and paste that info.
Awesome. Do we have time for questions?
Yeah.
I have time if you have time. Barb had a question. My supplement has selenium yeast. Should I ask the manufacturer if it is the organic kind?
I believe that yeast actually naturally contains selenium, so it probably is the natural version. But you can ask them, because some of them fortify their yeast and some of them it's actually part of the food itself. So it's definitely something you can ask them. The yeast itself sometimes will just contain it. And if it's a good brand, it will. The only thing with yeast is if you have a horse that's having any kind of gut related issues or skin related issues, sometimes yeast can be an irritant. So just depends on the horse. Sometimes it works really well for them though.
Awesome. Thanks, Sarah. Lori has a question. How do you feel about nutritional yeast for B vitamins?
They also contain a lot of B vitamins for sure. Again, it's really relative to the horse. And I think that mushrooms in particular probably have the biggest benefits, because it's not just the B vitamins themselves, it's actually a ton of different phytonutrients that are also included in, or polysaccharides that are included with the mushrooms when you're feeding them, that will actually make it so that your horse can use the vitamin B better. But if you feel like if you know that your horse has a B deficiency and you've had that tested through their blood or whatever it is, and your vet has told you that that's the case, definitely start working on their gut health. That's number one.
Thank you. I goofed up. I'm supposed to give the mic to people. Sorry, guys. Allison,
Oh, yeah.
shoot, I'm sorry. Allison, do you want to come on the mic and ask your question, Allison? I'll give you the ability to talk here.
Sure. Hello.
Hi.
Hi. Yeah, my question is about hemp and hemp hearts. Have you used the shelled hemp hearts?
Yeah.
As a way of getting the omega-3s in there? It seems to have a really good balance between omega-3, 6, and 9, and I would assume that's good for horses as well as people.
Yeah, I use that in my rotation. So I do hemp seeds, and then sometimes I also do like organic hemp oil. That's the only oil that I use with horses. And I feel that if you are rotating through hemp and some other omega-3 other seeds, that the 3 ratio will be a bit higher. And a lot of horses need a little bit more than if you were to just stick them on hemp all the time. But
Right.
Hemp has a lot of other nutritional benefits, so it's a really great one to rotate through. But I like to rotate through seeds and not give them the same ones all the time.
Yeah, I like the idea of the chia. I hadn't thought of that before at all, but I have used hemp seeds before. They love it. It's really palatable, and it's quite easy to get in great big pails as well from Alberta. So, but it's good to know about the chia as well. Thank you.
Yeah, and make sure you soak it, because then it actually gets that gelatinous consistency to it, and that in itself is so helpful for gut health. It's a huge prebiotic. It will help them to rebuild their mucosal lining if they're having ulcer issues, and it gives them good quality access to a lot of different amino acids, which is also great for performance horses and training.
Great. Thank you very much. This has been extremely interesting. Thanks.
Thank you.
I've got a question from Melena here. Melena, if you'd like to take the mic, and before you ask your question, Poppy's on Facebook, and she's asking, how long would you suggest soaking the chia?
I usually put a cup of chia into, I guess it would be like a 500 ml container, and then I fill it up to the top, and then I soak it. You can soak it for an hour, is usually long enough, and then I just put it in the fridge. And then Kingsley gets a big mash concoction twice a day because he's very spoiled, and so I put that in when I feed him, and I do it twice a day. But you don't have to do that. You can do once a day is just fine.
Awesome, thanks.
But yeah, you want to make sure it's like really nice and gelatinous and like gooey, and that's what you're looking for. And then measure it after it's soaked.
Good. Awesome. Melena, do you want to take the mic and ask your question? You should be able to talk now.
Oh, she's still on mute, I think.
Oh.
Yeah.
Can you hear me?
There you go. Yeah.
Hi.
Yeah.
This has been really, really, really great. But the problem is I had 5 questions. So, but could you just read my first question? Because I can't remember which one it was.
Yeah, sure. What kind of mushrooms, and where do you suggest we get them from?
So mushrooms, I actually think that for right at this moment, the best ones are available through the human realm. I haven't done enough research on the horse ones to really, I don't have a company that I could recommend to you. So the ones that I recommend, they're from a human herbal pharmacy, and they're located in BC. So this is just for Canada, unfortunately. Is Harmonic Arts, and they're amazing, absolutely amazing.
Harmonic. Okay. So I'll look them up. We have been using reishi mushrooms for our Clydesdale with heaves.
Great.
and they actually were really doing really good for his heaps. I mean, they didn't take them away, but he was a lot lighter.
Mm-hmm.
So, and we did find a company, and I can't remember what it is. I've got it listed in the barn,
Mm-hmm.
but maybe I could send that to Kaylin, who could then maybe get it to Julie, to you, or something, where we're getting our horse mushrooms. Yeah.
You have to be really, really careful what they're grown on.
Yes.
Like,
Yeah, I was just gonna say.
Yeah. Well, apparently they're grown for horses, but yeah.
yeah,
Yes, it's
like,
also different.
actually grow on. Like, if they growing on, they can be grown on so many different things, and it's
Mediums, yeah.
yeah. So that's an important one to find out.
Yeah, so the ones from Harmonic Arts, the reason that I recommend them so highly is that they have really done their research on and the farms that they use are amazing farms that know which mushrooms need to be grown on which mediums, and and to get the medicinal properties to come into the actual mushroom itself.
Yep.
They know exactly what to grow it on, and they also only use organic mediums, which is also really important, because if you're not paying attention, a lot of them are grown on just like wheat, and they're full of glyphosate, and they actually don't even the fruiting bodies don't even have all of the nutritional value, and they're just grown on wheat. So some of them need to be grown on.
You know what? Mushrooms are a whole different thing. Like,
we're gonna maybe have to do a talk on.
We'll do.
That's
organic mushrooms.
Yeah.
Something that you say that they're organic, and they could be organic, but they could be also grown on, like Sarah said, they could be grown on wheat, they could be grown on rice, they could be grown on something that isn't what their natural species of that mushroom would be grown on, which brings the medicinal value down to like almost nothing.
Wow.
Yeah, so
well, I'm so glad I asked. Because I didn't think about them being grown on their meat. I just figured the people that were really growing the mushrooms and using them medicinally would have them to their native soil. You know what I mean? That would grow them in their. So I'm really glad I asked that question.
Well, not only that.
Well, he seems to be doing good on them, so hopefully they're okay.
But Melina, what I wanted to say, like, not only that, like Sarah and I will do. You guys can hear me, right?
Yep.
We'll do some more information on mushrooms, particularly, but even mushrooms, the way they're harvested, the way they're cut, in the when they're ground, if they're not ground in a super specific way, that actually all the enzymes can be destroyed. So.
Wow.
And they, like I said, they can be certified organic, and it doesn't really matter. Mushroom is a whole art on their own. Like, it's pretty incredible. The more I learn, it's like, oh my gosh, it's like a completely different world.
They're a whole planet. They're a whole different planet, aren't they? Yeah. So I have a very quick question. When you rotate your flax, your chia, and your hemp, do you do like a day, or a week, a week?
I don't really do it that way. You could do it that way if you wanted. I like to, I'll buy a bag of chia, I'll use that up. I'll buy flax, I'll go through that, then I'll buy something else and I'll use that. Just so that they're not always just on the same thing. So I almost feel like it's better to do it one at a time and then just rotate through them. It's a lot less of a headache too if you do it that way.
Oh, it would be less too, and I guess you get a gut feeling for it too, don't you? I mean, I sometimes do with stuff. It's like one day I'll go in there and say, "Don't feed that." I mean, I don't know why.
If you have a horse that has, like I said, a selenium deficiency, which is lots of horses, but if you have a horse that has is showing signs of or has heavy metal toxicity and things like that, I do like the chia because of the gut healing properties, and they are really high in selenium as well.
So would you, if a horse was like in that like in one of the categories where it would need selenium, would you then keep them, or are you still going to rotate off the chia?
I would probably keep them on chia for an extended period of time
Okay.
until you see a difference. But if they're really deficient, and then you might have to supplement anyway. So that's
Okay.
why I gave you the food options and also the supplement option, because some of them, you just in the beginning, they just need to get ahead because they just can't get enough to get them back to where they should be, like their actual homeostasis. So so sometimes you have to just give them a bunch more than they would be able to get in food. And if their gut is damaged, then
I'm gonna say that. That's what I was gonna say. Like if
give
your
them probiotics.
values up,
Yeah. Well, I have 9 horses and it's getting really expensive. So yeah, I'm trying to do it the cheapest way I can to make them all well.
yeah, but sometimes, Melina, you're gonna be spending more money if you're not focused on their gut.
Yeah, that's right. Yeah.
That's your-
I love the gut soothe, by the way. I had a pit bull that really, probably most people would have put her down,
Mhm.
but I just heard in my head, it's her gut. And then I called KK and she put me on with you, and I ended up buying the gut soothe and the phytosynergy. And she was on my probiotics, actually. I just threw her on the same ones I was taking. And she doesn't attack she can think now.
Mhm.
She's not crazy.
That's
Yeah.
But you know what I wanted to say really fast? I have a horse rescue here, and we have 3. I've had 3 come in with such bad COPD that they could hardly like walk off the trailer without looking like they were gonna.
Hmm.
And that equine gut soothe is incredible for COPD. Like
Really?
unbelievably.
Okay.
Yeah, joint related anything.
It's got the NAG in it, the N-acetylglucosamine. And what NAG does is it's an anti-inflammatory for any smooth muscle. So when you take that and you have the L-glutamine, marshmallow root, slippery elm, those are all natural anti-inflammatories for anything that's smooth muscle. So these horses, I mean, you can now and then I'll have to give them homeopathic remedies, but not very often. You used to go outside and all you could hear with them almost like I would say they would coughing synergistic or coughing like synchronized swimming.
Yep.
One would cough and the next one would cough and then the next one would cough and we're like, oh my god.
So how are they with their COPD now? Like, how are they? Are they?
You don't even hear them cough.
Do you see their flanks go in and out? Is their nose open?
No, not even remotely like that. If they're ever that bad, it's usually the change in seasons. One of them, if it goes from like fall to winter or spring to summer, I'll hear him a little bit. So we'll increase his gut soothe, and then I give him some homeopathic remedies for a little bit, and then he just evens off again. But no, like they're like. The one, he looked like a barrel, probably from inhaling so much air, right? Like in his stomach muscles were extended. He looked like he swallowed a barrel, and he doesn't even he just looks like a normal horse now. It's amazing.
That's really amazing. Yeah. Well, I would love to know your other remedies along, and I'll get some gut soothe for Jack because he's been on so much steroid. This horse. It's all I knew how to do. And that the reishi mushroom came into my brain. We looked it up. We gave it to him. He's better, but his nostrils are flaring. He's going out. He's going to need another round of Dex. And believe me, it's a lot of Dex.
Have you tried other types of mushrooms or just the reishi mushroom?
Just so far the reishi, we've gone through one bag, like one big bag of reishi, and it really did seem to quiet it, but it's not like we can get away without the dexamethasone. It's really all,
Yeah, there's lots you can do though, but I was just looking because I saw something in the chat that a woman was taking. Oh yeah, I use gut soothe daily. I'm asthmatic and I have a super powered seasonal allergies, and I've cut back in my inhaler by half.
It's me, Julie.
That's
You're the one that prescribed. You're the one. Yeah.
tell you. Okay.
You're the
So-
one that got me to start taking it.
Yeah. So there you go.
Wow.
The other one is the mushroom that's indicated for breathing issues is cordyceps.
Cordyceps, yeah.
Yeah.
Cordyceps.
So it might be a better one to try. I believe that the cordyceps are way more expensive because of what they're grown on.
This?
But yeah, they are the ones that are indicated highly for.
But-
Yeah, quercetin. Okay.
Yeah, but if your horse has been on a lot of steroids, especially dexamethasone,
Mm-hmm.
I can guarantee you that your horse's gut is going to be trashed. Like I can pretty much just tell you that, because horses in general, I was so blown away by like statistics. They say that 90% of all horses that have ever shown in their, like I think it's 60% of all horses will have either upper or lower gut ulcers, and like 97% that have raced or shown will have ulcers.
We have some of them. Mm-hmm.
So I think that I think it's awesome. Like I think that you should do the cordyceps and you should do the mushrooms and you should do everything. But just like Sarah said, if you're not, if his gut is really not doing well, you could pay a fortune, and he'll never be normal. Like he'll never recover. So
if you're telling me he can recover, I'll try, but I really didn't think he could recover. We were just kind of holding him out. Like we were just trying to make him comfortable, really. And that might sound bad, but I've never had good experience with heaves. So
I'm not saying that you're going to be able to ride him around and whatever.
we don't care about that. We don't care about
that. But for him to have a really good quality of life, I can't tell you how many horses I've worked on with heaves. You must have worked on heavy horses too, eh, Sarah? Yeah, heaves can be really well monitored. And I know people are going to think this is a terrible thing to say, but the one horse that we have now that is still, I would say sort of active in it still. I have like 9 horses, and they all eat together. They all move around together. They're all together all the time. So I can't soak their hay, and they get hay outside, and it's winter time and whatever.
Yep.
He doesn't get soaked
Yep.
hay. Super anal about making sure that it's not dusty and it doesn't have any mold or anything like that in it. But he's not on soaked hay. He gets the gut soothe, and he gets homeopathic remedies, and he's just doing amazing, like totally amazing. So I would seriously think about working on his gut as well as everything that Sarah said. But I think
so the gut soothe then, I don't really know what else to do, but the gut soothe, maybe the Fido. You were saying other homeopathic remedies, but
homeopathic. Do you have she could also just contact you, and you could talk to her about what remedy.
There's a lot of different remedies that are good for COPD,
Okay.
and sometimes combination remedies work really well, but it's usually something that you have to see like individually what is going on.
Yeah.
Absolutely. I'll contact you and find out. I'm really happy about this because I hate giving them that. We spent $1,400 on a nebulizer to put the dexamethasone through so it didn't hit his body, but it just didn't work. So we had to go back to the powder.
Yeah. Honestly, I would do that. And when you talk to Sarah, like with this guy that I have now, everyone that works here, he has 2 different things. So he has an emergency combination, so that if all of a sudden we hear him coughing, or someone knows to watch his nostrils, or if he's in distress at all, we have emergency remedies, and he gets them like every 20 minutes to half an hour, and he gets 5 doses of them, and then he'll get them 3 times a day for 2 days. And touch wood, thank God, he's like right as rain. Like he's just Goes right.
Wow.
Love
Wow.
it.
Well, thank you so much. Thanks a lot. That's pretty cool.
No problem.
Melina, I put the Sarah's website and the cordyceps spelling in the chat if you just scroll up. Okay, 2 more questions if you guys don't mind.
Sure.
One is from Deb. She's asking if you've got any recommendations for ring bone. She's a 22 and just retired. She eats EQ8 senior textured feed.
Well, I am not a fan of processed feed at all. I don't like it. I don't know, like you can't tell what's actually in it a lot of the time, and there's a lot of things that they don't have to include on the label that you might be feeding to your horse. So it's also highly heat treated, and I find it depends on what's going on with it. How old did she say the horse was?
Sorry, I missed the window. She's 22.
Okay. If she's not on a calcium supplement, she probably should be. A lot of horses that are that age, they're dealing with the same kind of stuff that we are, that kind of osteoporosis related issues. But again, it's probably the best thing you can do is focus on their gut. And then once you focus on the gut, then you could do some blood work and or hair testing or both, and then figure out from a nutritional perspective what it is that they actually need. And even while you're doing that, you can still put them on some gut support and make a big difference right even before you start finding out what's wrong on a test. So that's always the way that I like to approach it. I pretty much, if an animal is having a health condition, I always wonder what is going on with their gut first, because like that's why I wanted to show you guys my horse's kidney issues, because you know there's certain things that we link to gut health, but it affects everything. So it's something that is foundational, right? So
And I don't know where they are, like where they live, but and how they're trimming, right?
Yeah.
Like
yeah.
I've seen, again with my rescue horses, I've seen horses that can't even get off the trailer from everything from, you know, side bone to navicular to the worst cases of laminitis that you've ever seen. And a really, 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 really talented barefoot trimmers can do amazing things with like together, right? Like not just that and not just that, but really making sure that you're using a really good trimmer. Like I've used for 15 years, I've used barefoot trimmers, and probably longer now, probably close to 20. Some are really great, some are not so great. So you have to like, some of them are like really not that great. So you would want to make sure that they're accredited by some what they can do. What we should do is put a list on the Adored Beast to which accredited barefoot associations that we would recommend. Because like I said, some of them are great, some of them aren't great. And the best thing to do is word of mouth, right? Ask people, you know, have you used them? What did you use them for? That kind of thing. Because, you know, some people that swear by them, some people don't. I know that the Ontario Mounted Police are using barefoot trimming now, and they never thought that they would be able to do it because the horses are on concrete so much, like pavement. And I think they've been doing it now for 7 years. And they said that their incident of structural hoof problems have decreased by 80%. So, you know, it's not for everybody, but if that would be something that I'd be looking at too, with that, along with everything that Sarah's talking about. What do you think?
you are shoeing your horse, farriers are in the same boat. There's really, really good ones, and there's some not so good ones. So you want to make sure that you can get either through word of mouth or through your veterinarian, because if a lot of times the best farriers are actually making a difference, and the vets are actually going, oh, you should go and see this guy or this gal, because every time I send someone with this problem to them, then the horses are better, right? So it goes for barefoot and for farriers as well. Some people are just really gifted.
Yeah.
It's
And
a whole art in itself.
and if your trim is not good, or whatever, if their feet aren't being taken care of the way they really need to be taken care of, then it can be a complete nightmare.
Yeah, very devastating.
Yeah.
Wow.
I need to get my power cord, so my not die.
Okay, then we want to put you in the hot seat. I've got the last question. It's a doozy.
Give me one sec.
And I'll tell a little story about that. Is I had 2 rescue donkeys, and when I rescued them, they came from a petting zoo, and they had the worst cases of laminitis you could possibly even imagine, and white line disease. And Jenny, the older one, she was the most amazing thing on the planet. She actually lost her hoof capsule.
Oh.
Everybody said to me, you have to put her down, you have to euthanize her, what you're doing is cruel. And I had the most amazing barefoot trimmer in BC. And she said, you know what? Let's cast her foot. Let's put a cast on her foot. And we did, and we changed the cast every probably 9 weeks, and that donkey grew a whole hoof back. Like it was
At Jenny.
That was Jenny. Yeah, remember that? Like it was just like she still has all the pictures, like a documented pictures. Like it's just unbelievable. And then I have a big, huge Shire, had a big, huge Shire and stuff. And now I have a Clydesdale, and he had side bone and broke it. And like he had a broken foot. And the trimmer that I'm using now here is pretty incredible. So yeah, I think that's a big part. Okay, so but I saw something that I think Barb asked to Sarah. She said her well water is high in iron. Should I be careful feeding chia because of the excess iron?
Chia is not that high in iron. It does have iron in it. We have high iron here. A lot of horses are on wells that have a lot of iron in them. So yes, you have to be careful, but I would probably, the best way, if you know that your water is high, there are filters you can use. If that's something that you're able to do, and then making sure that you're balancing the other minerals in their diets to make sure that the iron isn't just way higher than everything else, because iron has a relationship with other ones, just like calcium and phosphorus have a relationship. If they're really out of whack, it can be an issue. If you put them back into alignment a little bit more, having a little bit higher is not as much of an issue. The other thing that you can sorry, I just totally lost my train of thought. The other thing you can do is make sure that your I'm sorry, totally lost my train of thought.
I've done that so many times.
Filters, iron.
Yes, yeah. Filters are the best if you can do that. I know that's not ideal. Like you can't do that with every well. But I don't think that chia is going to cause an issue. It's more if you're using like a supplement and you're really giving them a lot of extra. I think the benefits outweigh the amount of iron that's in it, though the best way to check would be to just check their blood work. If you haven't checked their bloods, you can easily check what their iron level is on their blood work. And sometimes even if your well is testing high, your horses are still doing okay. So that would be something I would say, just, keep an eye on their blood work, especially if you have horses that have health condition, and it's a good idea to test their blood anyway.
Yeah. And also if you're worried about heavy metals or too many minerals, you can use fulvic and humic acid too, right? Like chelation to help draw out iron or arsenic or any kind of heavy metal.
Yeah, good point. I didn't even think of that.
Sorry, I missed that one, Barb. Okay, last one of the night. You ready for this?
Oh.
Uh-oh.
It's for both of you. It's for both of you. Okay. When is Equine Gut Soothe going to be available?
Oh.
Well, we don't know quite yet, but soon.
It's really soon. Like,
yeah.
we had our meeting today about it, and I would say within the month.
Yay! Woohoo! Awesome.
Yeah.
Very exciting.
Oh, it's really exciting. And Sarah forgot to say one little tweak about it, but that.
Oh yeah. Well, that thing, the probiotic part of the Equine Gut Soothe is going to be really cool because it has that 14 strain that's in all of the other probiotics, but it also is going to have a species-specific equine probiotic in it, which is the only one. There's no other ones. So that's pretty cool. That's probably one of my favorite things about it. And I'm obsessed with species appropriate everything, and I think species appropriate probiotics that's why fecal transplants work. And I think that this is the next best thing to that, and I think every horse can benefit from.
Or even sometimes, yeah, like the one that Sarah used with her horse, it didn't even have it in it.
Mm-hmm.
The one that we're launching is going to have that added benefit, which is massive. That's why it's taking longer. Or we could have just made Gut Soothe in a bigger bottle, like I send it to Sarah for her horse. Yeah, I think it's going to be a pretty spectacular thing with that one added, and yeah, it's very exciting. And just quickly on that note about fecal transplants, they are amazing, but I would say that sometimes when an animal has a really, really, really bad leaky gut,
Mm-hmm.
that sometimes transplants are too hard on them, right? It's just like they reject them. So when your gut is really, really bad, whether you're a horse, dog, person, it doesn't matter. When you think of, I know everyone's heard of, if you get a kidney and your body doesn't accept the kidney, or like it rejects it.
Mm-hmm.
Often what can happen with transplants, fecal transplants, is if the animal or the person isn't strong enough, they can actually reject it, right? Because it's just too much for them to handle. Oh, you limping? My dog is limping. Ugh.
Oh, no. Already too hard.
Oh, so yeah, so that's the nice thing about doing a species appropriate probiotic, is because you're getting the benefits of that, but you're not taking a risk. Mm-hmm. The risk as well, right?
Yeah.
So yeah.
There's a lot of horses out there that are in a worse state or about to be in a worse state, and if you can get ahead of it, I think it's such a preventative measure that, like, every horse, no matter what age they are, I think they can benefit from having the gut support.
Yeah. All right.
Okay. Can I ask one more question that's not related to tonight's topic, please?
Sure.
It is, Michelle's got a question. Oh, bear with me, sorry. I'm just trying to find, I have a question about using homeopathy to get rid of an energetic imprint of a snake bite for a dog.
Hmm.
An energetic imprint? What does that mean?
Michelle, help me out. Let me put you on the mic here really quick. Hey.
Hello, ladies.
Hello.
I'm so sorry about throwing in a dog question on the horse night. Okay, so energetic imprint. Basically, he got bit by a pygmy rattler, but it's been 4 years ago. But it still flares up on his muzzle every once in a while, and he will dig at that thing until he is bleeding from his face. And it is literally the same exact spot where he got bit by a pygmy rattler. So I did herbs and all of that. And he actually went into anaphylactic shock. So I know that there was a lot of an energy process that happened with him, as far as almost like a post-traumatic thing for him after that. So I'm just wondering, if, and I know that homeopathy can address the energy of something, whereas an herb may not necessarily do that. So I just wondered if, there was something that you guys would recommend that I could do when he has a flare.
Yeah, well, if he's having chronic problems, there is a homeopathic remedy made out of rattlesnake venom, and I would give him that.
Yeah.
Okay. Okay.
It's called lachesis.
No, there's another one that's rattle.
The other rattlesnake one. Is it bush? Something bush, isn't it?
There's a Bushmaster, but that's not it either. There's an actual one of rattlesnake venom.
Okay.
I remember the Latin name for it.
I'm trying to think of it too. She might be able to get it.
Is it Crotalus? I can't remember.
Crotalus horridus, is that it?
Yeah.
It might be. You know what? We can, if you email us.
I'll just look. I have a book on snake remedies, so I'll look it up for you.
Yeah.
Okay, thank you so much.
Send us that.
At home.
What kind of dog is it?
It's for a boxer.
A boxer.
Yeah, and he was only, let's see, when that happened, he was a little over a year old.
And
so now he's 5.
What's he like? What's his personality like?
A little bit of a spaz, but he's a huge lover. But he's definitely very high, which is, kind of the boxer thing. That's all I've had for 30 years. So they're, very high energetically, but he's also very needy. He's got, he does some separation anxiety stuff and a little needy. So all of that definitely kicked in more after the snake bite, for sure.
Yeah.
So definitely like there's, definitely about an energetic imprint there. And Julie, I just wanted to say to you, I've been an energy practitioner for 25 years now. And I got my Phyto Synergy in the other day, and oh my God, it's amazing. I literally, as soon as I pulled it out of the package, I was like, oh, holy cow, the energy of this is fantastic. I literally, I've done herbs for 30 years. I've never felt anything like that the entire 30 years I've worked with herbs. It was amazing.
Yeah, it's a pretty special one. That's
absolutely.
Sure. Yeah.
Yeah. Thanks, ladies.
We were very, 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 very lucky that I came across the scientist that does that for us. Like it's the whole energy of where that is grown it's unbelievable. It's grown without electricity, it's grown sustainably, it's filtered from the toxins, and then the filtered water goes back into the ocean so that it's actually feeding back into the ocean. We don't take any food up. It's sustainably grown on land, so it's not raping the oceans of its food. It really is amazing.
Well, I also just decided I was going to start taking it myself too. So
Yeah. If I don't take it, it's so weird. Like I take it twice a day.
hmm
Sometimes if I'm feeling a bit weird or tired, I'll take it 3 times a day. But if I'm rushing, I don't know, like around 2 or 3 o'clock, I just feel like I'm just draining, and I'll be like, what is wrong with me? Oh my God. And then I'll be like, I didn't take it. Like that's how much energy it gives me. It's ridiculous.
That's cool.
Well, honestly, I've been testing water now in Florida for cyanobacteria for a little over a year. So I'm extremely, extremely careful about where I get algae sources from. Like I won't do spirulina if it's not been tested for microcystins and BMAA and that kind of stuff. So when I heard you talk about phytosynergy a couple weeks ago, I was like, yep, I need to order that because it just sounded extremely clean. And then I watched your video online too. So yeah, I'm super, super happy to know that you are very stringent on those sources, because that means people just don't realize, that they need to test spirulina and other, types of cyanobacteria that are used as superfoods for cyanotoxins. And a lot of the labs do not do that. So it is paramount that they be tested for that, because my dog actually ended up with DM from being in Florida and being around algae blooms. And I've worked with scientists in Wyoming now, and we realized that the area where we lived has the highest amount of BMAA in the water of any water sample pulled in 2 years in Florida. And they have connected that to ALS and Alzheimer's and Parkinson's. So of course, DM is basically ALS. It's the same genetic mutation.
Yeah. Interesting, eh? Holy. Yeah, it's pretty cool.
That's really cool.
Yeah, well, I'm happy to hear that you liked it.
Oh God, I just couldn't believe like when I pulled it out of the package, I literally went, oh my God, this is crazy.
Wow.
So yeah, thank you. I'm very in tune with the energy of stuff. So that was amazing to me. And I actually got a human patient, one of my human patients today, I sent to your website to get that and the gut soothe for her.
Oh, good. Sarah, how do you give Kingsley the phytoplankton? Like, do you mix it in his food, or do you hide it in a piece of apple?
You can do both. I just put it into his, like, he gets a big mash with water. So I do his gut soothe and the phytosynergy and everything in his mash.
Yeah.
I break it up into like half doses, so because he gets one in the morning and one at night, because he gets a lot of water. I'm always hydrating him because of his kidney. So, and I like to give it hydrated. Like I like to give it, with lots of water, because I feel like it's easier for them to.
Yeah.
That way.
Yeah. I have some horses that'll eat it no problem. Some horses I have to core out an apple.
Yeah.
Apple, smoosh it around, and then give it to them. Because it's really fishy, right? It really is not fishy. Like I always say, it tastes like swamp water. But
It is really strong too. I think spirulina is stronger.
it is.
I don't like it either. I just take it in capsules because I can't handle it. So I feel like horses, some of them, they need.
I take my phytoplankton orange juice.
Oh yeah, that's a smart idea.
Shot of orange juice, or mango juice.
That's a good idea. And horses, you might be able to get away with like a little apple juice or something like that. Yeah. But if you eat an apple with it, that's a good way to get.
Yeah.
They don't need.
Pardon?
They don't need very much.
No, that's the cool thing about it. It's just a tiniest little bit.
Yeah.
Okay, Steph.
All righty. Thanks, Michelle.
Thank you so much, ladies. This has been awesome. I really appreciate all your time.
No worries. Thank you for joining us.
All right. That's it for questions. We made it through every single one. Thank goodness. Thank you for being here, Sarah, and thanks for putting together that awesome presentation.
Yeah, it was real. I loved it because it was very concise.
Mm-hmm. Like a cheat sheet.
overwhelming. So to have the top 6 is really helpful.
Mm-hmm.
Really helpful, because sometimes, you know, even as much as I know about stuff, you start talking about it, it's just like, oh my god,
No, it's so crazy.
too much.
I always just come back to trying to do it with food, because I think if you do it with food, you're gonna, and you do it early enough that then you don't have to deal with all the aftermath of not doing it for a really long time. So I'm preventing through food.
For sure.
Yeah.
All right. Well, thank you.
Thanks,
Thanks, Sarah. Have a good night, everyone. Thanks for joining us. See you next week.
Bye.
Bye.